CNA Prep videos. Welcome to the quiz. Question 1. Following an exposure to a patient with suspected tuberculosis, you must don personal protective equipment before entering the airborne infection isolation room. Understanding the proper sequence for applying PPE is essential for both effectiveness and safety. Which of the following represents the correct order for donning personal protective equipment when preparing to enter an isolation room requiring full barrier precautions? Option A. Apply gloves first, followed by gown, then mask, and finally protective eyewear. Option B. Put on the gown first, then the mask or respirator, followed by eyewear, and finally gloves. Option C. Don the mask initially, then protective eyewear, followed by gown, and complete with gloves. Option D. Start with protective eyewear, then mask, followed by gloves, and finish with the gown. The answer is B. The correct sequence is gown first. Question 2. Documentation represents a critical component of patient care with important legal and clinical implications. As you complete your shift duties, you reflect on the fundamental principles that should guide all nursing assistant documentation entries in the patient's medical record. Which principles should serve as the primary guideline for all CNA documentation practices regarding patient care activities? Option A. Document only positive observations and interventions that reflect well on the care provided. Option B. Adhere to the standard that if care wasn't documented, it's considered not to have been done. Option C. Keep all documentation entries brief and general to avoid excessive time commitment. Option D. Complete all documentation at the end of your shift when you can concentrate fully. The answer is B. The legal principle, if it wasn't documented. Question 3. A 74-year-old patient with a history of congestive heart failure who is taking furosemide, a diuretic medication, reports feeling lightheaded and dizzy when transitioning from sitting to standing positions. Mr. Jenkins nearly lost his balance this morning when getting out of bed, and he describes seeing black spots when he stands up quickly. Based on his symptoms and medication regimen, which specific condition should you suspect and promptly report to the nurse? Option A. Uncontrolled hypertension with elevated systemic blood pressure. Option B. Orthostatic hypotension related to medication-induced volume depletion. Option C. Hyperglycemia potentially indicating undiagnosed diabetes mellitus. Option D. Urinary tract infection causing generalized weakness and malaise. The answer is B. The symptoms describe orthostatic hypotension, postural hypotension. Question 4. Prevention of pressure injuries represents a fundamental responsibility for nursing assistants caring for patients with limited mobility. As you develop a turning schedule for Mr. Davis, a completely bedridden patient with multiple risk factors for skin breakdown, you must establish appropriate frequency for position changes. According to evidence-based practice guidelines for pressure injury prevention, how often should a completely immobile patient's position typically be changed to minimize pressure on bony prominences? Option A. Every 30 minutes to ensure constant pressure redistribution. Option B. Every 1 to 2 hours to prevent prolonged pressure on any single area. Option C. Every 3 to 4 hours to balance care needs with practical considerations. Option D. Every 6 hours coinciding with major care periods throughout the day. The answer is B. Patients should be repositioned every 1 to 2 hours to prevent pressure injuries. This frequency allows adequate time for tissue perfusion to recover while preventing prolonged pressure that causes ischemia and tissue damage. 30 minutes is excessive and disrupts sleep and comfort unnecessarily. 3 to 4 hours allows too much time for pressure damage to begin developing. 6 hours guarantees pressure injury development in most immobile patients. The 1 to 2 hour guideline balances prevention with practical care considerations and patient comfort while effectively reducing pressure injury risk. Question 5. Before assisting a postoperative patient with her first attempt at getting out of bed following abdominal surgery, several preparatory steps must be completed to ensure safety. As you approach Mrs. Chen's bedside to help her transfer to a chair, which action should you perform first in the sequence of preparatory activities for a safe patient transfer? Option A. Lock the wheelchair brakes securely to prevent movement during transfer. Option B. Raise the hospital bed to an appropriate working height to protect your back. Option C. Ask the patient to rate her current pain level on a 0 to 10 scale. Option D. Review the care plan and check for any specific activity restrictions or precautions. The answer is D. Always check the care plan first to identify any specific restrictions. Question 6. Accuracy in temperature measurement requires understanding the relative reliability of different assessment routes in various clinical situations. When discussing temperature measurement techniques during a new CNA orientation, the nurse educator asks which route typically provides the most accurate core body temperature measurement in clinical practice. Which temperature route is generally considered the most accurate reflection of core body temperature when properly obtained? Option A. Oral temperature obtained with a properly placed digital thermometer. Option B. Axillary temperature measured in a dry armpit with arm positioned correctly. Option C. Rectal temperature obtained with appropriate lubrication and insertion depth. Option D. Tympanic temperature measured with the ear canal straightened appropriately. The answer is C. Rectal temperatures are considered the gold standard for core body temperature measurement because the rectum is close to core body temperature and less affected by external factors. Oral temperatures can be affected by recent food/drink. Great job! Don't forget to subscribe. Bye!